Ring enhancing lesions are the ultimate trap. They look similar, they sound similar, and examiners love to test your ability to differentiate them. One wrong recall, and the question slips away. So, in this video, we will break down these confusions and make your concept clear regarding the ring enhancing lesion and how to answer in MCQ. Let's begin with the first question given as a ring enhancing intracranial lesion shows marked hyperintensity on DWI with corresponding low ADC values in the central core. The most likely diagnosis is. So in given question the clue is central core and low ADC value. So we can see in this image this is a ring enhancing lesion, this is the DWI showing bright or hyperintensity, and this one is the ADC image showing dark central area. This is the dark central area or low ADC value in core. So this is the diagnostic image, and this suggests that this is a brain abscess. Why is this brain abscess? Because brain abscess shows true diffusion restriction due to the viscous pus, inflammatory cells and debris in the central core area of lesion. So this suggests that this is the brain abscess. A ring enhancing lesion shows DWI hyperintensity but ATC is not reduced. What is the most likely explanation? So this question is asking about the DWI hyperintensity and ADC is also hyperintense or not reduced. This is the hyperintense. We can see in this image there is a hyperintensity in DWI. This image is ADC, so this is also hyperintense. These all lesions are hyperintense in both DWI and ADC. So let's see the options. True diffusion restriction. In diffusion restriction there is a hyperintense DWI and low signal intensity or dark ADC. So this is called the true diffusion restriction. Pyogenic abscess shows the true diffusion restriction, and empyema also shows the true diffusion restriction due to the thick viscous pus, whereas the in this image both are high signal intensity. So the answer is the T2 sign through. So if there is high signal intensity in both DW and ADC, then this is called the T2 sign through. Which MRI sequence is most sensitive for differentiating brain abscess from the necrotic tumor? So let's see the options. First option is the T1 weighted image. So this is very essential for the visualization of brain anatomy and diagnosis of the hemorrhage, acute hemorrhage, calcification, fat, intracranial fat, whereas the T2 is important for the diagnosis of the pathology, intracranial pathology and brain edema, whereas the GRE-SWI is the important for the chronic bleed, whereas the DWI and ADC mapping is to see the diffusion restriction. So let's see the image. In this image there is a diffusion restriction. This central area is hyperintense in DWI, whereas the low in ADC. This is the true diffusion restriction. Whereas the next image, this is showing the DWI is low signal intensity and ADC is high signal intensity. So this is called the facilitated diffusion. In abscess, there is true diffusion restriction, whereas the necrotic tumor can show the facilitated diffusion. DWI with ADC mapping is the correct answer. Which component of a brain abscess demonstrates diffusion restriction on MRI? So this image shows that a ring enhancing lesion. This is the ring enhancing lesion with diffusion restriction, DWI high signal intensity and ADC shows the this low signal intensity. These are called the true diffusion restriction. Given options are the capsule, wall, surrounding edema, central cavity and adjacent cortex. So answer is the central cavity. Why? Because of the presence of viscous pus within the central cavity. So this will lead to the true diffusion restriction. So this demonstrates the diffusion restriction on MRI. So this is the correct answer. So as I explained in the previous question that the diffusion restriction is seen in the abscess in which region, that is the central core, and the same question can be asked like this also. The diffusion restriction in the brain abscess is primarily due to. So this is the cause. This is asking about the cause of diffusion restriction in abscess. So this is due to the high viscosity of pus. So central core is containing, so we can remember like this by logic that the central core is containing the pus in abscess. So this pus is causing the diffusion restriction. So we can make the three questions answer. The ring enhancing lesion with diffusion restriction in abscess, part where the diffusion restriction seen is central core, And what is the cause of the diffusion restriction is the high viscosity of pus. So this is explaining the three type of question and answer for the brain abscess. Which of the following lesion least likely shows the central diffusion restriction? So read this question very carefully because this is asking about the least likely. So sometimes we miss this word least likely. So least likely shows central diffusion restriction. So let's see the option. Pyogenic abscess shows the central diffusion restriction. Fungal abscess also shows the diffusion restriction, and empyema also shows the diffusion restriction due to the high viscosity of pus. So only one option is remaining, that the necrotic metastasis. So what we see in diffusion restriction, that is the DWI shows the high signal intensity, whereas the ADC there is no signal or low signal intensity. So in this image both shows the high signal intensity. So only one option is remaining, that is the necrotic metastasis. So necrotic metastasis does not show or less likely shows the diffusion restriction. So answer is the necrotic metastasis. Now the another question is asking about the brain abscess caused by the fungal infection. So here is the fungal infection. So this is more specified type of brain abscess, that is the fungal infection. Option is no diffusion restriction, restricted diffusion only in the wall, peripheral diffusion restriction with non-restricting core, and uniform low ADC in edema. Let's see the image. In this image we can see that there is a hyperintensity in periphery of the lesion in DWI, and in this image we can see that the low signal intensity in the periphery of the lesion, and there is high signal intensity in center in ADC, and DWI shows the low signal intensity in center. So this is called the facilitated diffusion, and this is the periphery is the low signal intensity, so peripheral diffusion restriction. So what is the answer? That is the peripheral diffusion restriction with non-restricting core. So why is this? In fungal type of infection, in previous slides we learned about that the abscess shows diffusion restriction, but in this case why we are saying that the periphery shows the diffusion restriction. So let's know about the explanation for this. So fungal abscess must show restricted diffusion in wall or projections or periphery. So why? Because the fungal infection are the angio-invasive. So this will lead to the vascular thrombosis and high cellularity of the abscess wall. So this is due to the fungal hyphae in the wall of the fungal lesion and inflammatory cells, causing restricted diffusion in the wall, while the central core is relatively acellular as compared to the pyogenic abscess. And there is a one clue that the MRS finding of the fungal abscess is the tree halos peak at 3.6 to 3.8 ppm. So this is the tree halos is the diagnostic for the fungal infection. So why is there wall diffusion restriction? Due to the hyphae and the inflammatory cells, and relatively center is the acellular, and this shows the facilitated diffusion. So answer is the peripheral diffusion restriction with non-restricting core. Which ADC pattern favors brain abscess over the glioblastoma? So this is asking about the differentiating point of the abscess from the glioblastoma. So options are the high ADC in core, heterogeneous ADC value, uniform low ADC in central cavity, low ADC in peritumoral edema. So answer is the uniform low ADC in the central core. So in abscess we can see that the central core shows the diffusion restriction due to the high viscosity of pus, and in glioblastoma there is uneven cellular growth and the necrosis shows the heterogeneous ADC or no diffusion restriction. So in this image we can see that there is a rim enhancing lesion showing the central high signal intensity in DWI and low signal intensity in ADC. So this is the true diffusion restriction. So this suggests that the brain abscess and uniform low ADC in central cavity. Which feature favors neoplastic ring enhancement lesion over abscess? So this is asking about the characteristic of neoplastic ring enhancement. So let's see the option: complete ring enhancement, uniform wall thickness, irregular nodular inner margin, and central diffusion restriction. So central diffusion restriction is seen in the abscess, uniform wall thickness and complete ring is also feature of abscess. So only one option is left, that is C, irregular nodular inner margin. This is the correct answer. So why is there irregular nodular inner margin? Because of the rapid growth of the tumor cells and aggressive invasion into the adjacent structures. So this will lead to the unorganized growth of the tumor cells and the necrotic area. So this is the irregular nodular pattern of inner margin. So this is the feature of aggressive tumor or neoplastic lesion. An incomplete ring enhancement open towards the cortex suggests. So this question is asking that there is a lesion with incomplete ring enhancement. This is the incomplete ring enhancement, and there is another clue is open towards the cortex. So this is the clue for this question. So let's see the options: metastasis, tumefactive demyelination, abscess, neurocysticercosis. So abscess and neurocysticercosis shows complete regular smooth wall enhancement, whereas metastasis can show irregular as well as complete or incomplete ring enhancement. There is tumefactive demyelination. So there are two options which shows incomplete ring enhancement, but the next clue is the open towards the cortex. So open towards the cortex is the tumefactive demyelination. So this is the answer, tumefactive demyelination. In this image we can see that there is a incomplete ring enhancement towards the center or white matter and open towards the cortex. So this is showing that there is open towards the cortex and no enhancement in the sentinel area. So this signifies that this is the active inflammatory process towards the white matter. This is the old chronic demyelination in the center, and this is the open ring towards the cortex is region towards the gray matter. So this showing that there is a less intense inflammation. So there are three parts in tumefactive demyelination ring enhancement. Which MRS pattern is most suggestive of pyogenic brain abscess? So this is asking about the metabolic changes in pyogenic abscess. So what we see, let's see the options. High choline peak. What does it mean? That the choline is due to the cellular turnover. It is the marker of cell membrane. Lipid lactate is the marker of abscess. Amino acid peak is specific for the abscess, and NAA is marker of neuronal cells. So this is the marker of neuronal cells. So these two are out of the race. Only lipid lactate peak and amino acid peaks are the correct answer, but in the option B there is given only. So in abscess we see amino acid as well as lipid lactate peak, but amino acid peak is more specific for abscess than lipid lactate peak. Correct answer is C. So this is the succinate and acetate. So amino acid peak, and this is the lactate and lipid peak. So answer is C. Which MRS findings favors high grade glioma? So again this is asking about the high grade glioma MRS changes. So let's see the options. Absence of choline. So as I said that the choline is for the cell membrane, and elevated choline with reduced NAA, amino acid peak and acetate peak. So these are for the abscess, and these two are remaining. So here what happens in high grade glioma? So this in high grade glioma we see increased cellularity. Tumor cells increase. As cellularity increases, what happens? Choline increases. So if there is high cellularity, then choline increases. So this option is also not correct. So only remaining is the elevated choline with reduced NAA. Correct answer is the elevated choline with reduced NAA. So as we can see in this image, this is the choline peak and this is the reduced NAA. Presence of succinate peak on MRS indicates options are the tumor necrosis, radiation necrosis, anaerobic bacterial abscess and tuberculoma. Succinate is amino acid. Amino acid peak is seen in anaerobic bacterial abscess. We can see here there is a succinate peak. So this suggests that this is a anaerobic bacterial abscess. Which perfusion pattern favors brain abscess? This is about the blood flow in brain abscess. So options are the high relative cerebral blood volume in wall, high cerebral blood volume in core, low in wall, and increased perfusion in edema. So as there is no angiogenesis in abscess, so there is a low relative cerebral blood volume in wall of the abscess. As we can see in this image, there is a ring enhancing lesion. There is hypointense wall, and there is minimal perfusion in wall. So answer is the low relative blood volume in wall. Ring enhancing lesion shows markedly increased relative cerebral blood volume in the enhancing rim. This is asking about the increased. Previous question was about the decrease or loss relative cerebral blood volume, but in this increased. So this suggests that there is neoangiogenesis. Neoangiogenesis. So this is seen in the neoplastic lesion, especially in high grade. So this is the high grade glioma. As we can see in this perfusion image, there is increased perfusion. There is also increased perfusion in wall, and this is the necrotic area. So answer is the high grade glioma. Which lesion typically shows low perfusion and diffusion restriction? If you have seen my whole video, then you must know that the answer. Low perfusion, in which condition it is seen? That is, the low perfusion is seen in the wall of abscess, and diffusion restriction is seen in core of abscess. So options are the glioblastoma. In this, increased perfusion seen. In metastasis also, due to the neoangiogenesis, increased cerebral blood volume or perfusion. In radiation necrosis, low relative cerebral blood volume or perfusion. In pyogenic abscess also, cerebral blood volume is reduced. But diffusion restriction is seen in pyogenic abscess, and there is no diffusion restriction in radiation necrosis. So answer is C, pyogenic abscess. Ring enhancing lesion in basal ganglia in an immunocompromised patient. Clue is here, basal ganglia in an immunocompromised patient. So answer is the toxoplasmosis, because this is a glioblastoma is neoplastic process, so there is no relation with the immune system. Metastasis is also no immune system related, and in abscess there is no role of immunocompromised patient. There is no predilection for the basal ganglia. But in toxoplasmosis, it has the predilection for basal ganglia due to the high blood flow in the basal ganglia and thalamic region. So they have affinity to the basal ganglia. And its differential diagnosis is primary CNS lymphoma. If primary CNS lymphoma is given in option instead of toxoplasmosis, then go for the primary CNS lymphoma in EBV associated immunocompromised patients. In given image, all are multiple ring enhancing lesions at gray white matter junctions, except, so the given images are abscess, metastasis, NCC, and demyelination. So as we know that the abscess, metastasis, and NCC occurs due to the hematogenous spread or local extension, but demyelination is not an infective process and it does not show any hematogenous spread. So all three shows the gray white matter junction lesion except demyelination. So answer is the demyelination. Another question is the which feature favors abscess over the metastasis? So options are the high relative cerebral blood volume rim, nodular inner margin, dual rim sign, satellite lesions. High relative cerebral blood volume in rim is suggestive of neoplastic or angiogenesis, and inner nodular margin is due to the uneven growth of tumor cells, and satellite lesion can be seen in both abscess and metastasis, and dual rim sign is seen in abscess. So why is this seen? Dual rim is formed by the outer low signal intensity rim, which is formed by the macrophages rich capsule with paramagnetic free radicals, and the inner margin is the granulation tissue, which is high signal intensity in T2 and SWI. So this is specific for the abscess. So answer is the dual rim sign. So these are my references, and thank you for watching. For a deeper dive, check out my full video titled Confused by Ring Enhancing Lesions. So keep learning, keep revising, and remember, clarity is your best weapon in the exam hall.